Camilla, very good to see you. What's your reading of all of this?
Well, we've got this extraordinary cache of documents. All of these WhatsApp messages amount to, we believe, 2.3 million words. And one can have a debate about whether they should be in the public domain. We certainly argue that they should be. We say that these messages are in the public interest because at an unprecedented time during the pandemic, it seems as if public health decisions were made on the hoof, that there was a degree of government by WhatsApp and that last minute changes to those decisions did affect people's lives. We know that there were casualties in the care home sector, particularly in the first 3 months of the pandemic. 25,000 residents died in care homes. Some of the decision making had already been under scrutiny. That diktat of April the 2nd, which allowed people to be admitted into care homes without being tested, had already courted controversy. But the idea that Mr. Hancock had then rejected Chris Whitty's proposal that all people going into care homes, not just those from hospitals, but those going from the community, should be tested is, of course, going to give a lot of cause for consternation, not only to care providers, but also, of course, the relatives of those who lost their lives during COVID.
And Camilla, you've written about this in the Telegraph today. I'd encourage anyone that can to have a read of it. But you talk about the narrative that the then Health Secretary put out at the time about the protective arm, the protective ring around care homes, repeated on multiple occasions. But these messages indicate that's quite the opposite of what was happening.
Well, I must declare a personal interest in this, Isabel, because my father, who's a retired GP, has run a care home for decades, and he was at the coalface of this and actually ended up locking down his nursing home ahead of government advice, sensing that elderly people would be in the firing line for this, and of course the most vulnerable, and we know that now. And at the time I wrote stories, and he indeed wrote for the Telegraph, saying how shambolic the testing arrangements were, how private care homes couldn't get enough PPE because they were being prioritised for the NHS. Of course, at the time, care providers were dealing with mass staff absences because staff were then going down with COVID. Even in September 2020, that was 6 months into the pandemic, there were multiple reports that we covered on the Telegraph of PPE still not arriving, of tests not being returned in time. So you then had asymptomatic residents and staff unwittingly spreading the virus. We know of care homes that lost literally all of their residents. So it's all very well for the government to say, we'll wait for a COVID inquiry. At the moment, we don't even know when that's going to report back to the public. Could it be 2030? That's not soon enough. What preparations are in place now for the government to avoid another disaster should there be another pandemic to hit Britain and the world? These are the questions we're asking. And in the interest of openness and transparency, we've taken the decision to publish these messages because we do think that sunlight is the best disinfectant.
Well, Matt Hancock, a source close to him, has reportedly said he felt that the correct place would have been the inquiry for proper analysis of these messages, not a partial, agenda-driven leak of confidential documents. But as you say, the paper very much taking the decision that on the balance of probabilities, this is very much in the public interest.
Well, we also know that there will have been other conversations taking place. And we stress in the copy, look, this was one dialogue. But what happened was, because of the rapidly changing nature of what was happening in the pandemic, and I think the public have got sympathy for that the government were placed in an extraordinary situation of not really having dealt with this before, although there was pre-pandemic planning that seemed to go out the window pretty quickly. Mr. Hancock decided to set up these groups to expedite decision-making. But our argument is, yes, but that decision-making now deserves proper scrutiny. You know, an inquiry isn't going to be comprehensive if it doesn't include all of these messages. And justice delayed is justice denied. There's a sense that this COVID inquiry is going to be a bit like the Bloody Sunday inquiry, go on for years and years and years, when the people who lost loved ones in COVID and the people who were denied access to their funerals and the people who had to look on while people were dying in hospital and they were back at home and weren't able to hold their hands actually need a more immediate answer to some of their questions than an inquiry that's going to take decades will allow.
What's the answer for Matt Hancock? He's tried this reinvention of himself, obviously looking to get back into the civilian world after the next general election, making himself a TV personality or whatever. What effect do you think this will have on that aspiration?
Well, I think there are mixed opinions about the wisdom of Matt Hancock writing books and appearing on I'm a Celebrity before this inquiry has got underway. This is not anything personal about Matt Hancock, and I think, again, the public can recognise that this politician had a very, very difficult job to do in unprecedented circumstances. So that's fine, but what we're saying is the public has a right to know how these decisions were made that affected their lives and the lives of their loved ones. You know, we're focusing on care homes today, but of course there's a lot of other decisions that were made that potentially compromise the educational life chances of a whole generation of children, and other decisions that were made that closed down people's businesses and has adversely affected this economy for months now.